Heel pain is one of the most common foot problems I see every single day in my Houston podiatry practice. But here's what surprises most people. The vast majority of patients completely misunderstand what's actually happening in their heel. My name is Dr. Andrew Schneider, and I'm a podiatrist with over 25 years of experience treating foot and ankle conditions. Today, I want to share the truth about heel pain that most people never hear. Let me paint you a picture of the typical patient who walks into my office. They wake up in the morning, swing their legs out of bed, and that first step feels like they're stepping on broken glass. The pain is so intense they actually gasp out loud. But here's the thing, after they walk around for a few minutes, it gets better. So they think, that's not bad. I can deal with this. Sound familiar? Then they tried stretching. They roll their foot on a tennis ball. They buy those gel inserts from the drugstore. They rest for a few days, and you know what? Sometimes it gets a little better, but then it comes back, often worse than before. The cycle can go on for months and even years. And the whole time they're telling themselves, it's not a big deal. They're tough. They can handle it. But here's what I want you to understand. Heel pain is your body's way of telling you something important. It's not just a minor inconvenience you should push through. It's a signal that something needs attention. Before we dive deeper, I want you to know that I've written a comprehensive guide about heel pain that goes far beyond what we can cover in this module. You can get this guide completely free at www.heelpainbook.com. I'll mention this again later, but I wanted you to know about it now because the information inside could save you months of unnecessary pain. Also, please take a moment to like this video, hit the subscribe button, and share with anybody you know who's been dealing with heel pain. This information could change how they approach their recovery. Now let's talk about what heel pain really is. When I say heel pain, I'm not talking about one simple condition. Your heel is actually a complex structure, and pain can come from several different sources. Think of your heel like the foundation of a house. It has to support your entire body weight with every single step you take. The average person takes about 8,000 steps per day. If you weigh 150 pounds, that's over 1,000,000 pounds of force your heels absorb every single day. The anatomy of your heel includes three main components that can cause pain. First, there's the heel bone itself, called the calcaneus. This is the largest bone in your foot and designed to handle significant impact. But even the strongest foundation can develop problems under constant stress. Second, there's the plantar fascia. This is a thick fibrous band of tissue that runs along the bottom of your foot from your heel bone all the way to your toes. Think of it like a bowstring that supports your arch and helps absorb shock with every step. Third, there's the Achilles tendon, which connects your calf muscles to the back of your heel bone. This is the strongest tendon in your body, but also one of the most commonly injured. Now here's why your heel is particularly vulnerable to pain and injury. Unlike other parts of your body that have multiple muscle groups and soft tissue for protection, your heel has limited cushioning. The fat pad under your heel provides some protection, but it's relatively thin compared to the forces it has to absorb. More importantly, your heel has limited blood flow compared to other areas. This is crucial because blood flow brings oxygen and nutrients necessary for healing. When tissues don't get adequate blood supply, they heal slowly and are more prone to chronic problems. Let's talk about the most common causes of heel pain because understanding what you're dealing with is the first step to fixing it. The number one cause is plantar fasciitis. This accounts for about 80% of all heel pain cases I see. Plantar fasciitis occurs when that bowstring I mentioned, the plantar fascia, becomes inflamed or develops tiny tears. The pain is typically felt on the bottom of your heel, right where the fascia attaches to the heel bone. The classic symptom is pain that's worse in the morning or after you've been sitting for a while. Why? Because when you're not moving, that's when tissue tightens up. When you suddenly put weight on it, you're essentially re-tearing healing tissue. That's why the first step is so brutal. The second most common cause is Achilles tendonitis. This causes pain in the back of your heel where the Achilles tendon attaches. Unlike plantar fasciitis, Achilles pain is often worse with activity rather than first thing in the morning. Then there's heel fat pad syndrome. This is exactly what it sounds like. The fat pad under your heel becomes inflamed or atrophied. The pain feels deep and bruise-like, and it's typically worse when you're walking on hard surfaces like concrete. There's also something called Baxter's nerve entrapment. This is a nerve that runs along the inside of your heel, and when it gets compressed or irritated, it causes burning or tingling pain. This condition is often misdiagnosed because symptoms can be very similar to plantar fasciitis. In rare cases, you might have a stress fracture in your heel bone. This is more common in athletes or people who suddenly increase their activity level. Now, here's something crucial that most people don't understand about heel pain. It's often degenerative, not just inflammatory. Let me explain what that means. When you first injure your heel, your body responds with inflammation. This is actually good. Inflammation brings healing factors to the area. But when heel pain becomes chronic, something different happens. Instead of healthy inflammation that promotes healing, you develop what we call degenerative changes. The tissue starts to break down at a microscopic level. Instead of normal organized tissue fibers, you end up with disorganized, weakened tissue. This is why heel pain doesn't just go away on its own like other injuries might. A sprained ankle heals in a couple of weeks. A pulled muscle gets bettered with rest. But heel pain can linger for months or years because you're dealing with tissue degeneration, not just inflammation. The poor healing environment I mentioned earlier makes this worse. Your heel doesn't get the blood flow it needs to repair itself effectively. And because you have to keep walking on it every day, you're constantly re-stressing the tissue before it can fully heal. This is also why those drugstore inserts and basic stretching often don't work for chronic heel pain. They may help with acute inflammation, but they don't address the underlying tissue degeneration. So when should you take heel pain seriously? Here are the red flags that indicate that you need professional evaluation. First, if your pain has lasted more than 4 to 6 weeks despite rest and basic home treatment, that's a sign you're dealing with something more than simple inflammation. Second, if the pain is affecting your daily activities, I'm not talking about elite athletic performance here. I'm talking about basic things like walking to the car, going grocery shopping, or playing with your kids. If heel pain is limiting these activities, it's time to get help. Third, if the pain is changing in intensity or location, maybe it started as a mild morning stiffness, but now it's a sharp pain throughout the day. Or maybe it started on the bottom of your heel, but now you're feeling it in your arch or the back of your heel. Changes in your pain pattern often indicate that the condition is progressing. Fourth, if you've tried multiple home remedies without lasting improvement, I'm talking about rest, ice, over-the-counter pain medication, stretching, different shoes. If you've tried these consistently for several weeks without significant improvement, you need a professional evaluation. Here's what many people don't realize. Early treatment is so much more effective than waiting. When heel pain is caught early, we can often resolve it with a couple of relatively simple treatments. But when it becomes chronic, it requires more intensive intervention. Think of it like a small leak in your roof. If you fix it right away, it's a simple repair. If you ignore it for months, you end up with water damage, mold, and structural problems that require major renovation. The same principle applies to heel pain. Early intervention can prevent a simple problem from becoming a complex, chronic condition. I also want to address something I hear all the time in my practice, the fear of surgery. Many people avoid getting their heel pain evaluated because they're worried they'll be told they need surgery. Here's the truth. Less than 5% of heel pain cases require surgery. The vast majority can be successfully treated with conservative methods, but the key is getting the right diagnosis and the right treatment plan. Surgery is typically only considered when conservative treatments have failed after several months, and even then, we have many advanced non-surgical options that weren't available a few years ago. Let me share something that might surprise you. Some of the most successful athletes in the world have dealt with heel pain. NBA players, NFL players, Olympic runners. They've all had to sit out of games or even entire seasons because of plantar fasciitis or Achilles problems. These are people with access to the best medical care, the best physical therapists, and unlimited resources for treatment. If heel pain can sideline professional athletes, it's clearly not something to take lightly. But here's the encouraging part. With the proper treatment, Most of these athletes return to full competition. The key is getting the right care at the right time. So what's the bottom line? Heel pain is one of the most common foot problems, but it's also one of the most misunderstood. It's not just something you have to live with. It's not a normal part of aging. It's not something you should just try to push through. Your heel pain is telling you something important. It's your body's way of saying that something needs attention. The sooner you listen to that signal and get proper evaluation and treatment, the better your outcome will be. Understanding the cause of your heel pain is the first step to fixing it. In our upcoming modules, we'll dive deeper into how to get an accurate diagnosis, what treatment options actually work, and how to prevent heel pain from coming back. But for now, I want you to remember this. You don't have to suffer with heel pain. There are effective treatments available, and the vast majority of people get back to their normal activities without surgery. If you're dealing with heel pain that's been going on for more than a few weeks, or if it's affecting your daily life, don't wait for it to get worse. The earlier you address it, the easier it is to treat. Thanks for watching this module. Please take a moment to like this video. If it was helpful, subscribe to the channel and so you don't miss future content, and share it with anyone you know who's been dealing with heel pain. Don't forget to get your free copy of my comprehensive heel pain guide at www.heelpainbook.com. It contains detailed information about everything we've discussed today, plus specific treatment options and prevention strategies you can start using immediately. If you're currently dealing with heel pain and want to get properly evaluated, contact our office to schedule an appointment. The link to schedule is in the description below. Remember, understanding what's causing your heel pain is the first step to getting your life back. Thanks so much for watching, and have a great day.